Before her appointment, Dr. Jill asks Kelly to complete an intake form to provide a view of her past medical history. Kelly looks to the list of questions on the patient health form that Dr. Jill has asked her to complete. The questions ask about her health, education, personal life, and recreational drug use. They also seek information about her family history and her experience receiving preventative health care services. Although Kelly recognizes and has responded to many of these questions before, she still does find some of them intrusive. Why am I being asked to share whether I get the flu shot or do drugs? As she signs the form, she wonders what exactly she is agreeing to. What does it mean to consent to the use and collection of my healthcare data? So, when Kelly begins her appointment with Dr. Jill, she decides to ask Dr. Jill to help explain to her why she is being asked to consent to the collection and the use of her digital health data. Dr. Jill explains that digital health data is one of the ways that healthcare providers, like herself, can make decisions about treatment and care. The information that Kelly has provided to Dr. Jill is just one part of the patient journey, but it is an important one for trying to understand Kelly's health. Kelly appreciates Dr. Jill's explanation, but she's unsatisfied with it. She still feels like she does not understand what digital health data is and how it differs from information, a term that she is more familiar with. Kelly asks Dr. Jill to explain the relationship between information and data. Dr. Jill tells Kelly that information generally refers to data that has been collected and organized in some way. For instance, data collected about one's blood pressure becomes information when it is put together to show a pattern, a change over time, or a sudden decrease, which may indicate an underlying illness. Data from multiple sources can also be put together to help a researcher understand illness or help a clinician treat it. Kelly gets the difference between data and information, but she does not fully understand why Dr. Jill was asking her to provide so much data in the first place. Why was she being asked about her family history and current medications? Would all this data be turned into information? Dr. Jill appreciates Kelly's concern. She tries to better explain how a wide range of data can be used by a clinician like herself to improve health outcomes. She explains that there are two ways that data can be used to examine outcomes: patient-recorded data, such as questionnaires that ask patients to report how they are doing, and clinical report measures, which focus on what a clinician identifies. Dr. Jill can use various clinical measures to determine outcomes. This would include taking Kelly's heart rate or blood pressure. She can ask Kelly to provide her with her own assessment. Together, patient and clinician data can seem like a lot. Dr. Jill explains that this is all to make sure that any possible data that could improve outcomes is not left out. Kelly is satisfied that Dr. Jill has thought about what data means for her as a patient. She wonders, though, about the digital aspects of health data. What makes health data digital? Is health data digital simply because the collection is completed through digital means, such as using a tablet? Although Kelly is hesitant to ask because she feels like she's asked too many questions already, she goes ahead and asks Dr. Jill. Dr. Jill is reassuring. She tells Kelly that it is all right to ask questions. It's important that you understand what you are consenting to. She then goes on to explain that Kelly is right about digital health data. Health data is digital because someone has decided that something is going to be measured and then has used a digital tool to either capture or store it. Now that she has learned about digital health data, Kelly feels much better about having signed the patient intake form. She feels more in control over the data and has consented to share and understands why Dr. Jill was collecting it.